Welcome again to Introduction to Experimental Psychology, Psych 224. This is session 6 of this course, and in this section I'm going to talk about extraneous variables. So I've mentioned over and over again about extraneous variables and how they have to be controlled in experimentation. I've mentioned the fact that extraneous variables can act as independent variables, and that is why it is necessary to control them. So in every experiment, you are likely to have extraneous variables affecting the outcome of a study, and that means that internal validity is affected as well. Now, there are general extraneous variables, there are participant effects, and there are experimental effects that can all affect the validity of an experiment. So these are the things I'm going to talk about. So by the end of this session, you should be able to define what an extraneous variable is and distinguish it from an independent variable. You should be able to discuss the various types of general extraneous variables, as well as outline participant and experimental effects that can act as sources of extraneous variables. Finally, you should be able to explain how all these extraneous variables can act as threats to internal validity in experimentation. So basically, I'll cover 4 topics in this section. What are extraneous variables? What are the general extraneous variables? What are participant effects? And what are experimental effects? And this is your reading list. This time I have just one textbook for you. Ensure that you read these pages in Christensen's book. So let's start. What are extraneous variables? Again, I'm sure you've heard it over and over again in the various sections. And as I keep saying, there are any variables other than the independent variable that can affect the outcome of a study. Any variable other than the independent variable that can have an effect on the dependent variable, but they are not of interest to the experimenter. So, extraneous variables will reduce the internal validity of a study. Remember, to achieve internal validity, we should be able to establish a cause-effect relationship, which should say that the independent variable is what caused the dependent variable to change, and no other variable. And that is why we have to control potential extraneous variables. So according to Hyman 1995, an experimenter can use the 4 general components of any study to help him or her identify extraneous variables in an experiment. And this is how he defines it. He says that the experimenter observes participants in specific environments and apply a measurement procedure. So you will notice that I've underlined 4 different words, and this is what you focus on as an experimenter to be able to identify the possible extraneous variables that can confound your experiment. So focus on the experimental variables, the participant variables, the environmental variables, and the measurement variables. So for example, if you take the experimental variables, will the presence of the experimenter affect the responses that participants make? Yes, that can happen. If you take participant variables as well, will the age of the participants affect the outcome of the study, where age is not an independent variable? Or will prior knowledge of a material affect the outcome of a study? If you take the environment, for example, if we don't control the environment, can it affect the outcome of a study? If we take, for example, noise can affect the outcome of a study, because if we conduct a study in a noisy environment, participants may not be able to concentrate on the tasks they have to perform, and that can affect the outcome of a study. Again, if you take measurements, that can also affect the outcome of a study. So for instance, we are looking at stress management and how it can improve the blood pressure levels of patients with hypertension. Now, if a measure of blood pressure, if the blood pressure monitor we are using is faulty, it means that whatever measurements that we take would also be incorrect. and that can act as an extraneous variable. So I will talk about the various types of extraneous variables: the general extraneous variables, participant effect, and experimental effect. So let's look at the first one, general extraneous variables. So Campbell and Stanley, 1963, identified 6 general extraneous variables that can act as threats to internal validity. And these are history, maturation, instrumentation, statistical regression, selection bias, and mortality or attrition. I'm sure you've heard me mention history and maturation when I talked about the experimental designs. So I'll discuss each of these 6 general extraneous variables. So history, it's events that take place or occur between the pre-test and post-test measurements of a study that can affect the outcome of the experiment. So sometimes when you conduct a study that involves pre-test measurement and post-test measurement, sometimes there's a gap between the time when you take the pre-test measurement and the post-test measurement. And between the time between these two measurements, anything can occur. So you can have history setting in as an extraneous variable, as I explained with the one group pre-test, post-test design. So history can act as a rival hypothesis that can change the post-test measurement. So for instance, if we look at the effect of time lapse on students' perception of this course that I'm teaching you, experimental psychology. So we want to find out that if students are given time, would they change their perception about this course? So at the beginning of the course, a couple of weeks, when we start the course, maybe 2-3 weeks, we would give out a questionnaire to students to find out their perception about the course. And then at the end of it, after 13 weeks of teaching, we administer the same questionnaire to find out whether students' perception has changed. Now, anything can occur between when we did the pre-measurement and the post-measurement. For instance, in between those periods, it's possible that we will take a test that would affect students' perception. So at our initial pre-measurement, we noticed that students have a very positive perception about the course. And then we do a test or do the interim assessment, and then students don't perform very well. At the end of the 13 weeks, we do a post-measurement and notice that students' perception has changed from a positive perception to a negative perception. In this case, do we say that is the time lapse that has changed students' perception, or is because of the event that occurred, which is the test that they took, which they didn't perform well? Looking at the flip side of it, imagine that students had a negative perception about the course because at the beginning, nothing was really understood. But with time, they are able to understand the course, and then we do a post-measurement. Now, in between the pre-measurement and the post-measurement, we take the interim assessment test, and then students perform very well. So that good performance changes their perception. So they now have a more positive perception about the course. Now, can we conclude that it's because of the time lapse, or is it perhaps because of the test that they took that they performed well on? We cannot really say. And this is why we say that history has had an effect on such a study. The history being the event that occurred, being the test that was taken that may have changed students' perception. Another example is looking at the effect of anger management on the violent behavior of secondary school children. Again, we do a pre-measurement and then we administer anger management to those that we find to have high levels of anger, for instance. Then at the end of the day, we notice that the behavior of participants have improved. So aggressive behaviors have reduced. Now, it's possible that something else may have occurred during that period that has affected the outcome of this study. It's possible that during the period where we were administering the anger management, an aggressive student misbehaved and was arrested by the police. So these aggressive students that we are studying may have reduced their aggressive behaviors, not because of the anger management that we gave them, but because of the event that occurred. Now let's move on to maturation. Maturation refers to changes that occur within the individual. So note the difference between maturation and history. With history, the changes occur in the environment, but with maturation, the changes are internal. They occur within the individual. So these changes could be biological changes or psychological changes in psychological processes. So I'll give you a typical example. Still using the effect of stress management on the violent behavior of secondary school children. We want to reduce aggressive behavior among these children. Again, there's a pre-test, and then we run anger management, and there's a post-test. We can have maturation affecting the study in the sense that perhaps students will mature over time. So sometimes as teenagers mature, as they grow, they mature, and then sometimes their behaviors will change. So it's possible that in the process whilst we're doing the anger management, the participants outgrew their aggressive behaviors. So they got to the point where they think, well, these are actually behaviors that are for the younger teenagers or early teenage years. It's not for older teenage years. So we have to outgrow these aggressive behaviors. And so they reduce the aggressive behaviors. So you notice that the change in behavior, the reduction in aggressive behavior may not have been because of the stress management, but perhaps because the participants matured over time and therefore they changed their behavior. Then we have instrumentation. There are changes that occur over time in the measurement of the dependent variable. So sometimes just being in an experiment or being tested can influence participants' performance in a later test, which means that you take a first test and then you take a second test. And because you have gained experience in taking the first test, you apply that experience in the second test. So for instance, I give you a test, a class test, and then I give you maybe a couple of weeks after I give you a second test. You can have what you call testing effect occurring, in the sense that perhaps when you took the first test, you didn't know how I wanted you to answer the questions, so you may not have performed very well. And then I went over with you how I would like you to answer my questions. So you learned and you gained experience from taking the first test. Then you take the second test and then you perform better. It is possible that the testing effect may have set in because now you have learned how I want you to answer the questions, and that may have improved performance, and not because of perhaps maybe the teaching strategy that was used to teach you. In terms of instrumentation also, sometimes some of the techniques that we use to measure the dependent variable may be subject to change during the course of the study. Remember, I gave an example that, for instance, if we are measuring blood pressure levels, if our blood pressure monitor is faulty, that can give us faulty recordings. And so at the end of the day, whatever blood pressure levels that we are basing our conclusions on may not be valid. And that could affect the kind of interpretations that we make about the findings of our study. And this is referred to as instrument decay. Sometimes it's possible that the calibrations on the instruments may have changed. I remember once I was involved in a research where I was administering stress management for people with type 2 diabetes. And then in one of the sessions, I noticed that when I took the blood pressure levels, it was the same for 2 or 3 or 4 participants, which was very unusual. So I checked and I noticed that the batteries in the blood pressure monitor was actually running out. And so I was getting the faulty readings. So instrumentation setting, instrument decay setting, And so I had to go back, change the batteries in the blood pressure monitor, and retake the measures. So imagine that I just measured one person per day and I didn't notice that the readings were the same. It means that I would have had instrument decay setting in as an extraneous variable. Now let me use the same old example of the effect of stress management on violent behavior. Again, you can have testing effects occurring in this instance, where perhaps just by taking the first test, the students become aware of their aggressive behavior. Perhaps they were not aware that they were behaving in aggressive ways, but as they read the items on the questionnaire, they noticed that their behavior was aggressive. So they reduced their aggressive behaviors. And so when we take the post-measurement, we notice that they have reduced the aggressive behaviors. It may not be because of the anger management, but it's because they became aware of the aggressive behaviors. The fourth general extraneous variable is statistical regression, which is the lowering of extremely high scores or the raising of extremely low scores during post-test measurement period. This can occur because participants may have been selected for a study because they may have scored extremely high or extremely low on certain characteristics. So what happens is that when you test them again, they may tend to change in the direction of the mean. I'll give you an example. So let's say that we want to again administer relaxation training as a form of stress management to reduce the stress levels of people who smoke, so that they can reduce the amount of cigarettes they smoke in a day. So we do a pre-test measurement, and then we select those who report smoking large amounts of cigarettes per day. Then we administer relaxation training, and at the end of it, we notice that they have drastically reduced the amount of sticks that they smoke. Now, it's possible that when we selected these quote high smokers or heavy smokers, it's possible that perhaps at that period they were having some challenges in their life, so they were smoking more than they normally would. But by the time we're taking the post-measurement level, they may have been able to deal with whatever situations or challenges they were facing, and for that reason, they had reduced the amount of cigarettes they smoke in a day. So it may not be because of the relaxation training, but because we selected them at a point where they were smoking much more than they normally would. So that is what it means by at post-measurement level, they regress towards the mean. So you have the next extraneous variable, which is selection bias. And selection bias occurs when you choose participants for various treatment conditions based on different criteria. So what it means is that these participants that you are studying in the various treatment conditions or the various groups of interest are not randomly selected and randomly assigned to the groups that you are studying. And it usually occurs when participants are selected from an existing natural group. So you select people because they are GANs, you select people because they are EVERS, you select people because they are FANTIs, etc. So you have different groups of individuals who may differ from the onset, and that affects the outcome of a study. So selection bias acts as a threat to internal validity. So if, for instance, you look at the quasi-experimental design where I talked about the non-equivalent control group design, you notice that with the example I gave, participants are selected at different times, and so the initial differences that may exist between the two groups can also affect the outcome of the study. So at the end of the day, apart from the independent variable, those differences could also affect the outcome of the study. Now, selection can interact with maturation, it can interact with history, etc., to affect the outcome of a study. So, for instance, if you take selection by history, for instance, it means that because you selected the participants at different periods, an event may have occurred in the environment that may have affected one group, and that event may not have occurred in the environment that may have affected the other group. So you have different groups of individuals who may differ from the onset, and that event may not have occurred in the environment that may have affected one group, and that event may not have occurred in the environment that may have affected the other group. So you have different groups of individuals who may differ from the onset, and that event may not have occurred in the environment that may have affected one group, and that event may not have occurred in the environment that may have affected the other group. So you have different groups of individuals who may differ from the onset, and that event may not have occurred in the environment that may have affected one group, and that event may not have occurred in the environment that may have affected the other group. So you have different groups of individuals who may differ from the onset, and that event may not have occurred in the environment that may have affected one group, and that event may not have occurred in the environment that may have affected the other group. So you have different groups of indi during the time before you measured the other group. And so you have history interacting with selection to act as a threat to internal validity. Then you have mortality or attrition, and that's the differential loss of participants from the various comparison groups in an experiment. So let's say you have an experimental group and a control group, and then you do a pre-test and a post-test. You're going to do a pre-test and a post-test. Now, sometimes participants may drop out of the study. So at the end of the day, you may end up with fewer participants in one group compared to the other, and that can act as a threat to internal validity. So if we are running stress management for people with hypertension, and then we are running it for 8 weeks, so after 4 weeks, some people will drop out of the study because they feel that they are able to manage their hypertension very well. So let's say it's those in the experimental group who drop out of the study after 4 weeks. At the end of the day, you have fewer people who may have gone through the training for 8 weeks. It's possible that those who stayed in it for 8 weeks were people who had high levels of blood pressure levels. That is why they stayed. So you notice that those who dropped out, who may have had manageable levels, are different from those who stayed in. And because perhaps we may have randomly assigned participants to the experimental and the control group, you have maturation, you have mortality, becoming an extraneous variable. So the two groups, you've lost some of the participants in one group, and so that becomes a threat to internal validity. This brings us to the end of general extraneous variables. Now, when we talk about participant effects, they are variables relating to the participant that can affect the outcome of a study. So these extraneous variables, the participant effects, you can have demand characteristics, good subject tendency or good participant tendency. You can have evaluation apprehension or negative attitude. So when you talk about demand characteristics, they are cues provided by the research context that can bias participants' behavior. So basically, cues in the environment that the participants will pick up from that will give them some kind of idea about what the research or the experiment is about. So cues such as the instructions that are given, the experimenter, rumors about the experiment, etc. So sometimes you may be recruited to be part of an experiment, and then you know people who have already been part of the experiment. So you ask them, what is this experiment about? What did you do? And based on what they tell you, you form your own impression about what the experiment is about. And so that could affect the kind of responses that you make. Or you enter a laboratory and you see an equipment there and you make up your mind what you think the experiment is about. And so the responses that you make may be because of the perception that you have about the experiment. They may not be a true reflection of your behavior or your responses had you not had that perception about the purpose of the study. Then we have good subject tendency, which is another participant effect. And that's the tendency of participants to change their behavior to act according to the ways in which they think the experimenter wants them to act. So for example, if let's say we want to assess drug use among teenagers. Now, if you have good participant tendencies setting in as an extraneous variable, it means that you are going to have participants behave in ways that will let them appear as being good in the eyes of the experimenter. So if these are teenagers who are involved in drug use, they may respond to your questions as if they have never even heard about the drugs that you are talking about. And that is what is referred to as good participant tendency. And if participants behave in this way, it means that we will not get a true reflection of how they perceive drug use or their involvement in drug use. The third one is evaluation apprehension, which is the tendency of participants also to change their behavior in order to appear as socially desirable as possible. And what this means is that sometimes participants think that the experiment is measuring their competence. So again, they want to appear as competent as possible. So for instance, if we're doing an experiment on the effect of feedback on performance, we want to find out that if we give participants feedback on a task they have performed, will it improve their performance? In such an instance, the participants may think that we are measuring their competence, we are measuring how good they are. They may not know that we are assessing feedback, and so they would change their behavior, or they would change the responses that they give. They will try as much as possible to work very hard or to perform very well because they think that we are measuring their competence, while on the other hand, we are actually assessing how feedback affects performance. So in this case, in the example I have given, you may have evaluation apprehension affecting the internal validity of such a study. Then finally, we have negative attitude. So some participants go to a laboratory with a negative attitude, and that can affect responses that they make. So for instance, in the case where, let's say a lecturer is conducting a research, wants to give out questionnaires to students to complete. Now, this lecturer says that each of you must complete the questionnaire before you leave the class. It's possible that you are not interested in taking part in the study, and you know that for every research that is conducted, participants do not have to be forced to be part of the study. But in this case, you are given no option, you have to take part in the study. So what happens is that you go and be part of the study with a negative attitude. Because you don't want to be there, you don't want to complete the questionnaire, and you're being forced to do it, you pick up the questionnaire and you just take no for every item on the questionnaire. So here you have negative attitude affecting the responses that the participants may make. So let me talk now about experimental effect. So these are changes in the participants' performance as that can be attributed to the experimenter. So there are things that the experimenter can do or events related to the experimenter that can change responses that participants make. So briefly, I'll talk about two of them: experimental attributes and experimental expectancy. When I talk about experimental attributes, Rosenthal 1966 identifies three of them. The first one is the biosocial attributes, which are things such as the sex of the experimenter, the age, the race, the religion. These can all affect the responses that participants make. So if, let's say, we are doing a study and then our experimenter who is administering the independent variable is one that is of a particular religion, which some participants are against, it may affect the kind of responses that the participants make. Or sometimes it's a male that is the experimenter, and some of the female participants have a different perception about males being involved in whichever study that is being conducted. That could affect the outcome of the study. So you have biosocial attributes acting as threats to internal validity. Then you have psychosocial attributes as well. So things such as the experimenter's anxiety level, social approval, hostility, etc., can also affect the responses that participants make. So sometimes if you have an experimenter who is hostile towards the participants, that could affect the responses that the participants will make. Or you could also have situational factors, such as whether you are using an experienced or a naive experimenter, whether the experimenter is friendly or hostile, etc., etc. The other experimental effect is experimental expectancy or experimental bias. So the influence of the experimenter's expectations regarding the outcome of the experiment. So sometimes, being an experimenter, you would have certain expectations. You have your hypothesis you are testing, so you are expecting the results to go in a certain direction. and this can lead you as an experimenter to unintentionally act in ways that can affect the responses that participants will make. So let me use a very typical example. Imagine I give you questionnaires to complete in class, and as you are doing that, I walk around and then I look on what you are doing and then I frown. What would that tell you? If you look at the frown on my face, it may tell you that perhaps the responses you are making is wrong, or the task you are performing is not right. So that may lead you to change the responses that you've already made. So sometimes the experimenter's expectancy, and sometimes also even the way the experimenter will give the instructions in the experimental group may differ from the way he or she will give the instructions in the control group, just so that his or her hypotheses are confirmed. So in a nutshell, I've talked about general extraneous variables, I've talked about participant effects, and then I've talked about experimental effects, which can all act as extraneous variables and threaten the internal validity of a study. So this brings us to the end of session 7.